Hello, I am Dr. Subramanian Kannan, consultant and head of department of endocrinology, diabetes and metabolism at Narayana Health City, Bangalore. I would like to share a few thoughts and few important messages on exercise and diabetes. As Indians, we generally have a lower muscle mass compared to our Western counterparts, the Caucasians. And in general, the incidence and the prevalence of diabetes has been increasing in the South Asian countries. And one of the factors that could be contributing to this rapid rise is that we are, as a country, have started moving less. The lesser we move, the lesser we put our muscles into action, the more insulin resistant we are going to become. Muscle is an important organ which can metabolize glucose without much help from insulin. Again, I repeat, muscle is one organ which can actually utilize or metabolize glucose without much help from insulin. So if you put your muscles to work, then your muscles can suck up the glucose from your blood and actually lower your blood sugar level, which actually works out to be a very good treatment for most patients who have diabetes. And we give medicines to lower the blood sugar level. If you can do that by improving your muscle strength and improving your ability or endurance that your muscles can work out, then you will have a significant impact on the blood sugar level. Exercise are of various forms. You have the typical exercise which involves running, jogging, swimming, which puts the muscle into active contraction and relaxation. Now these exercises are very good both for your diabetes as well as for your heart, because they test not only your muscles as well as it gives you a good endurance from a cardiopulmonary, which means that your lungs and your heart strength also is considerably better when you do these exercises. The other form of exercises which improve muscle strength are exercises like push-ups or doing dumbbells. Now these kind of exercises which continue to emphasize on tonic contraction of your muscle, or which puts your muscle into a tonic contracted state, also improves the muscle to improve its strength of the muscle and thereby improve the insulin sensitivity or the ability of the muscle to utilize glucose better. If you are a diabetes patient, exercise should form an important part of routine of your life. In fact, I would go on to say, if you are an Indian, you should exercise, because at a basic genetic level, we are all at a very high risk of developing diabetes. So if we don't exercise, then we are running the risk of getting this metabolic disorder sooner or later in our life. Now, people say that they have so many inhibitions to exercise. They say that my knees hurt, I can't walk for long distances, there's not much of place around. Now, one very simple advice that I give for most of my patients who are older, and this actually comes from my experience from the pregnant women, is we ask them to do short bursts of physical activity after their meals. If you don't have any significant cardiac problem, and if you don't have any chest pain or any difficulty breathing when you walk after your meals, and you are otherwise your heart is okay, then it is perfectly all right to walk after your meals. So we ask some of our patients to do 15 to 20 minutes of a brisk walk after their breakfast, 15-20 minutes of brisk walk after their lunch, and 15-20 minutes of brisk walk after their dinner. Some people are not able to do the afternoon walks. They might as well double up and do about half an hour to 40 minutes of brisk walk after their dinner, which in this scenario, after their meals, their blood sugar levels start to go up. And by doing the exercise after your meals, you're actually employing your muscles to suck up that extra glucose so that you don't allow the glucose to go up too high. In fact, studies have shown that pregnant women and elderly people who walk after their meals, actually this walk constitutes an effect that is equal to that of a medicine. So I would say my diabetic patients that walking after meals can be a very effective way of lowering your glucose levels. Again, there's an important caution here. If you have active cardiac disease, if you have had cardiac illnesses, it would be prudent to check with your cardiologist before you embark on this activity. For the younger people, I would say running and muscle strengthening exercises are a very important part of their routine so that they can improve their endurance, muscle strength, as well as build up their core body strength, which in turn can help them fight against diabetes. If you don't have diabetes, you should run. If you cannot run, walk. If you cannot walk, at least move. Because if you are motionless, then you run the risk of developing diabetes. Thank you.